Okay, Dr. Rendon, thank you for meeting with me about arthritis. So we've got some commonly asked questions about arthritis in pets, if you don't mind answering. The first one is going to be, what causes arthritis in pets?
Can be a couple of things. A lot of the times there's multiple factors, whether it's a old injury, a dog that's been really active and just used the joints. One of the technical terms is degenerative joint disease is the same as our osteoarthritis. So the joints have been used repetitively over years with active animals or ones that have had an injury at some point. When there's damage to the joint, it's never quite the same as a baby new, fresh, healthy joint. So it sets the joint up for some loss of cartilage, the body trying to be helpful, and it brings bone in to try to help stabilize things, and you have bone on bone, which is not super fun, and leads to osteoarthritis.
Okay, thank you. Does it ever go away?
No, unfortunately not. The inflammation can be decreased, pain can be managed and gotten rid of, but the damage that's already been done, unfortunately, can't be gotten rid of, which is why we love to be proactive. Unfortunately, yeah, not.
Okay. Are medications always required for all arthritic pets? And also, do over-the-counter supplements actually work?
Fun question. So medications are not always indicated. I like to compare to humans because we are humans. There are a lot of other methods, things like exercise, bending and stretching exercises that we can do for our pets, massage therapy, heat therapy, light therapy are all non-medicational options, medicinal options, I guess. There are the pharmaceuticals and the nutraceuticals are what those over-the-counter joint supplements are considered. They are in a category very similar to our medications or our over-the-counter supplements that the companies have to prove that they're safe. They may or may not be effective for that individual in that particular condition. So it's mostly trying to be cognizant about the amount of the things you're looking for, the amount milligram-wise of the glucosamine, chondroitin, fish oils. With that being said, they are very effective if you find a good source that has the appropriate amount for your pet. Glucosamine and chondroitin help give those values back to the body so that as the body is trying to heal, it has those things to be able to try to restore some of the things lost in those damaged joints. Fish oils go the added step where they are seen to have anti-inflammatory properties within the joint as well.
Okay.
So they can be effective. Just means either in my opinion, just use a veterinary sourced one because they have done a lot of the work for you. They have done the studies to make sure it has the milligrams they need, and when you dose it by weight, it should be more accurate. When you're doing it over the counter, it's just a little more work to make sure you're getting what you want out of it.
Thank you. Another one is, how can you tell if a cat has arthritis?
Cats are fun. Cats are sneaky. Cats are very stoic. A lot of animals are, but cats are very well known to not always show signs of discomfort the same way as others. So a lot of the times it's little things that you may not associate, things like not getting on a favorite stool anymore, or having to kind of think about jumping up onto an object instead of being the young little kitten that just bounds right up. It might be a little hesitation of, ooh, can I make that? Do I want to make that? Ouch. And they may or may not do it, or they may try, and instead of making it all the way, they may have to pull themselves up.
Okay.
Similarly, when they're going down off of stairs or objects, it may not be the nice, graceful hop down. It might be I slide down a surface, or I have to kind of really think about doing it. There can be other behavioral signs, too, that cats may wind up urinating or defecating outside a box because they're having a hard time getting in or out, or onto certain surfaces. Food issues can be related depending on where bowls are. So a lot of the times it's these little environmental changes.
Okay.
Does that make sense?
Yes, absolutely. Thank you. Is physical therapy an option?
Yes. So yeah, that goes into some of the categories of some of that stretching activity, massage therapy, but there's even extra steps, things like hydrotherapy. There are some great locations and companies that can help you do it, or you can find ways to do it on your own. But massage therapy, physical therapy, hydrotherapy, all those things can have a great purpose.
Okay. Is laser therapy really effective?
Yes, in my opinion, and in a lot of articles and studies and reviews, it is seen to be effective. Similarly, you have to find what works for each animal. So some, it may hit different receptors for each pet. Their pain may be made in different ways. But laser therapy is a thing called photobiomodulation, where essentially it's using light and this laser, ultrasonic laser light, to hit certain target cells that have these receptors that when that light hits them, they have anti-inflammatory properties and release those anti-inflammatory cells and signaling pathways to try to reduce inflammation, which then causes comfort.
Okay. And how fast does it spread or get worse? Does that question make sense?
It does.
Okay.
Yeah.
How quickly can we expect it to kind of worsen over time?
It depends on the dog, or the pet, I should say, and what you do about it. If it's kind of untreated, really depends on their day-to-day activity. If you're doing a lot of high motion things on top of it, it's gonna get worse a lot more quickly because you're doing those things that have a lot more concussive energy, a lot more force on the joints. If you are proactive with it, it may progress very slowly. You may see very little signs for a long, long time, if ever. But when one joint is affected, it can affect almost every other joint in the body. If one limb, say one knee, is damaged, every pet should then compensate on the other limbs. So then those are adding more pressure because they're making up for the one that's damaged or weakened. And over time, it will affect other joints.
Okay.
It just depends on how proactive we can do and what we can do to slow it down.
Okay. And related to that, our last question comes from my family. How is its effect different for an amputee pet?
Yes, amputee pets do have a special, unfortunate predisposition for osteoarthritis. When you remove an entire limb, every part of the body is now compensating, not just the other legs, but if you think about it now, their core, their spine, everything else is having to take the load, and every movement is slightly different in various ways. And so it does mean the rest of the body, unfortunately, is adding a little bit of an extra strain. Similarly, just being proactive and finding different ways to manage all those little sources and keep the joints that are left as healthy as possible is the goal, to slow it down. But unfortunately, yeah, amputees do have a little bit of an uphill battle.
Okay. All right. Any other notes that you have, or is there something that you just wish everyone knew about arthritis in pets?
I would say, along with these lines, there's so many options that didn't used to be available. Every animal, every human, every family is different. Just because what you've heard about arthritis doesn't sound like it's going to work for you, I would encourage you to reach out to your veterinarian and have a conversation about what day-to-day life looks like for you and your pet, because there is something that can work for everybody, and the goal is just to keep our pets as comfortable and happy as possible.
Perfect. Thank you so much for your time.
Thank you.
Appreciate you.